The goal of this presentation is to explain how you should handle the transducer in order to achieve optimal quality in ultrasound scanning. Handling the transducer correctly is an important part of daily clinical ultrasound practice and should not be taken too lightly. Inaccurate handling of the transducer could lead to errors in scanning. Please hold the transducer with your first 3 fingers as shown in these 2 images. It's important to hold the transducer at its base, as this enables you to use your 4th and 5th fingers to make contact with the skin of the patient. This skin contact is important for 2 reasons. First of all, it improves the stability of the transducer. It prevents it from sliding away due to the ultrasound gel and ensures that one maintains a steady and controlled course of the transducer while scanning. The second reason is that the skin contact provides tactile input. The fingers that rest on the patient's skin feel the curves and shapes of the patient, which gives you the chance to adapt the transducer angulation to any changes. These 2 pictures demonstrate the incorrect method of holding the transducer on the left side and the correct method for optimal stability and control on the right side. On the left image, the sonographer is holding the transducer too far away from the base and does not have contact with the patient. As a result, the transducer is unstable and makes it difficult to follow a certain anatomical structure over a longer stretch. The image on the right demonstrates the appropriate hand position, where the sonographer has a comfortable grip of the transducer at its base with the thumb, index, and long fingers, while maintaining good contact with the patient's skin with the small and ring fingers, as well as the ulnar portion of the hand. These pictures demonstrate an excessive grip when holding the transducer in the left image and appropriate grip in the right image. In the left image, the sonographer is grasping the transducer with excessive grip, which results in increased difficulty performing smooth transducer movements during the examination. The right image shows an appropriate grip. This grip, a grip with relaxed muscles, allows smooth and easy transducer movements with good balance and also prevents undue strain during the examination. This image shows an inappropriate transducer grip. It is too high and with little stabilization. This image has been created for didactical reasons to clearly show the exact transducer position on the skin of the patient. The message of this slide is: place the transducer gently on the skin of the patient. Don't apply too much pressure, otherwise you are going to distort the shape of the underlying soft tissues or squeeze away fluid collections. In such cases, misinterpretation or misdiagnosis is possible. This picture demonstrates toggling of the transducer to change the angle of incidence of the sound waves on the tissue. Note that the position and the angle of the transducer changes from the left image to the right. This maneuver is used to reduce the anisotropic artifact. The angle is changed without moving the base to a different position. Simultaneous movement of the base while toggling should generally be avoided to prevent a confusing change of too many components of the image. These pictures demonstrate the heel-to-toe rocking of the transducer to change the angle of incidence of the sound waves on the tissue. Note that the position of the transducer is changed from the left to the right image. This maneuver is used to reduce the anisotropic artifact of tissue in long axis. With heel-to-toe rocking, the angle is changed without sliding the base to a different position. One important comment to the picture shown in this slide. When using the heel-to-toe maneuver, try as much as possible to keep contact with the patient's skin. The heel-to-toe maneuver in the left image and the toggle maneuver in the right image require gentle movements, refined motor skills, and good coordination. The proper outcome is to reduce or avoid anisotropy as much as you can. As soon as you can see that the region of interest shows the highest ergogenicity possible, you can stop performing the maneuvers at exactly that point. Sonographers are known to be at an increased risk of developing occupationally related musculoskeletal pain or injury. Results indicate that, although all the investigated scans involve injury risk, the specific risk factors and their relative importance varies between scan types. Make sure that your wrist is not being forced in end range angles or ulnar or radial deviations as shown in these two images. Always ensure that you have a comfortable grip, a fairly neutral wrist position, and low muscle tone. Not only the wrist is a risk factor when scanning patients in a non-ergonomic way, but also the shoulder and neck region. The left image shows a sonographer scanning a patient with large shoulder abduction and elbow extension angles, which produce a long moment arm at the shoulder joint. The right image, a more appropriate situation, shows a scan which results in a small shoulder abduction angle and a large elbow flexion angle, which produce a short moment arm at the shoulder joint. The bottom line is this: think about your ergonomic situation and try to optimize it as much as possible. Be aware that when performing many scans, the repetitive movements and static positions could lead to musculoskeletal discomfort or even injuries. Make use of good ergonomics to provide a comfortable position for both the examiner and the patient to improve the ease of scanning. Thank you for watching.